Hello everyone. Today we are going to discuss about care of patient with skeletal traction. I'm Ms. Jansi, tutor working at M College of Nursing. Let's see what are the objectives. At the end of the lecture, the listener would be able to list the principles and list the common sites, list the complications and discuss the nursing care of a patient. Introduction. Skeletal traction involves placing a pin, wire or a screw in the fractured site. After one of these devices has been inserted, weights are attached to it so the bone can be pulled into the correct position. This type of surgery may be done using a general, spinal or local anesthetic to keep you from feeling pain during the procedure. Skeletal traction is most commonly used to treat fractures of the femur or thigh bone. It is also a preferred method when greater force need to be applied to the affected area. The force is directly applied to the bone, which means more weight can be added with less risk of damaging the surrounding soft tissues. This is a picture of the skeletal traction. Definition. Traction is application of pulling force to a part of the body. It is used more frequently in management of lower limb fractures. It is a force applied mechanically or manually generated by weights or forces used to reduce fracture, dislocation, or to achieve immobilization of a part. Okay, moving on to the principles. Traction must be continuous, then should be effective in reducing and immobilizing the fractures. Skeletal traction is never interrupted. Weight should not be removed in case of continued traction. We must also keep in mind to maintain a good body alignment of a patient. Patient should be in center of the bed when traction is applied. Ropes should not be obstructed. Weight should be hanged freely and should not be resting on the bed or floor. Equipments required are a Steinman pin, Denham's pin, and K-wire. Common sites are affect olecranon, metacarpals, upper end of femur, lower end of the femur, upper end of the tibia, lower end of the tibia, and calcaneus. These are the common sites affected with fracture. Complications include infection, skin breakdown, watch the elbows and heel of the unaffected leg, DVT, pneumonia, constipation, urinary stasis and UTI, incorrect placement of pin, compartment syndrome, ligament damage, depressed scar, and stiffness of joints. These are the complications. So let's move on to the nursing care. We must keep in mind what is traction. It indicates temperature, extremity, and the infection we have to look for. R represents ropes hang freely, and A is the alignment of the body, and C is circulation check 5Ps, and T, it is indicating the type and location of fracture. I is nothing but increased fluid intake, and O, overhead trapeze should be monitored, and N, no weights on bed or floor. This is a traction mnemonic. And now let's see, keeping all this in mind, what a nurse should do. A nurse should maintain effective traction and maintain good body alignment of the patient. Observe pin sites for redness, dryness, odor, swelling, and excessive warmthness. Monitor for impaired blood flow. Check the proper functioning of the equipment. Monitor skin condition for irritation and the pressure points. Inspect all the knots, ropes, pulleys, weighs every 8 to 12 hours for any loosening of it. Assist for positioning. A special note, care to be given for weights, ropes, pulleys, foot plate and trapeze specially. These are the nursing care. What are the general care? Keeping all this mnemonic in mind and 5 P's in mind, the general care includes Assess the neurovascular status such as color, pain, sensation, ROM, joint motion, capillary refill, pulse, complaints of numbness, swelling over the extremity. Check the skin areas over Achilles tendon, dorsum of the foot, heel and sacral region. Avoid pressure in the popliteal space. Never change or lift traction weights without a doctor's order. Never drop a weight. When reapplying traction, but gradually lower the weight so the patient does not undergo sudden extreme stress. Position the patient flat to avoid hip flexion contractions. Encourage active and passive range of motion exercises and encourage to take adequate fluids. So these are the general care. Hope you had understood the topic. These are some of the references and thank you.